let's talk a little bit about the future.
Okay.
Talk about your platform and some of the things you would like to accomplish. And, in many cases, it'll, the wheels will turn to accomplish it after your presidency. But talk about some things in your platform that are important to you and that you hope to advance.
Sure. So we've talked a little bit about it already. First is wellness. Dentistry is a very hard profession, mentally, physically, emotionally.
Would you share, it's a statistic that I know that I share with my dental students, but would you share the statistic of how someone who's experienced an addiction, how successful are they at successfully overcoming their addiction on their own?
So 3 to 6% of people who have addiction get better on their own.
3 to 6.
Right.
Now
and
share.
less than 10% of people who have the addiction illness, and it is an illness, it is a brain disease, less than 10% of people who have it are actually afforded the opportunity to get treatment. Okay.
And of
Translate
those that do, that then share, because it's a
3 to
powerful
6%.
statistic.
Right.
Those that do get help professionally, like say through the ADA Council, what kind of success do we see there?
So the beauty of this is, the 3 to 6% success rate on your own, 70 to 75% of those who go through our professional wellness tracks are successful. They overcome and they get habits. And the reason that is for 5 years, you're required to do things for your recovery that are tied to your ability to practice dentistry. And it's kind of a scary
you had
proposition for those coming into this, that I
you
don't
experienced that yourself, not just academically and philosophically. You experienced that yourself.
Yeah, and I had to go through one of those programs when I entered my license in Colorado. I joined one of those programs, and I had to do random drug testing, and I had to do, see an addiction medicine doctor, see a therapist, go to recovery meetings, and and it was a pain in the butt at first, but then I recognized that everything they're making me do strengthens my recovery, and so it turned into something that was more of a compliance mindset, where I had to check a bunch of boxes, to an opportunity to better myself. And it usually happens to most people who go through these programs, and they're very grateful for it. So it is a wonderful opportunity for healthcare professionals to get help. And
Brett,
so
I remember this because it had such an impact on me, with my family history, that, and certainly you are a man of many accomplishments, and you've competed in the Ironman World Championships in Kona twice. I could name many other accomplishments, but there's one particular accomplishment that you're most proud of. Would you share that with our listeners?
Yeah, October 21st, 1998 is my sobriety date, and it's a day-by-day deal. That's 25 years. 5 months and however many days, 20 days or something like that, but it's a day-by-day thing, and it's the foundation of everything I have.
And I remember you telling me one of the things you were most proud of was that none of your children had ever seen you under the influence of addiction.
I have 4 kids that never saw me drunk or high. And I think I've been able to successfully break that cycle for the family moving forward. But let's talk back about wellness though. Like, you don't have to, let's not get people when they're hit rock bottom.
Right.
Let's provide resources on the sine wave up here, and they're maybe going down the downslope of that sine wave. And so, and I talk about this to dental students, I talk about it really across the country, but dental students seem to resonate with it most. That you are your most important asset, most valuable asset. Okay. If you go down, your student loans don't care. Your mortgage payment doesn't care. You need to pay it back. You need to be able to have the capacity to produce. And the better you are wellness wise, the better you can produce and do what you're meant to do. So I look at wellness in 5 dimensions. Okay. The first is physical. You want to make sure that your physical health is good. So I do Ironman races. You don't have to be an Ironman athlete to be physically fit. Okay. But do something every day to get your heart rate up. Do something every day to build muscles. Our friend Uchi Odiatu talks about your muscle fibers have no idea how old you are. Muscle cells have no idea how old you are. Whatever age you are, you can grow muscles and bone density.
I'm trying to trick my muscle fibers to thinking that I'm a lot younger.
Me too. So take care of your physical health. Be careful, be cognizant of what you put in your body. The choices you make on what you eat is really important. Ultra processed foods is not good for you. There was an article in New York Times this week about that. So that's important. Sleep is very important for physical health. So all these things is part of physical. Second dimension is mental health. Okay. And not just saying, and we'll get to mental illness, but mental health. Grow your mental capacity on a regular basis. Okay. Listen to podcasts like The Thriving Dentist. Okay. Listen, watch, presentations to grow your dental skills. Read books. Watch good shows. Find opportunities to grow your mental capacity on a regular basis. Okay. Because your brain will start to decline, and the more you exercise your brain, the less chance of that happening that will debilitate you in later life. Okay. Emotional wellness. This is where we talk about mental illness. And, Jimmy Valvano from NC State talked about, every day I can laugh, I can cry. That's a good day. Feel your emotions to the most possible way you can. And if you can't, if you're numb, go seek help. Seek help to unlock that. And we're going to have some resources to provide mental health opportunities through telehealth and other things for our members. We're working on that right now. Spiritual is the fifth dimension. Grow your spirit. When I say spiritual, many people go right to religion or God, and that's great. Okay. But I'm, from my standpoint, what fires you up every day to get you out of bed to attack the day? What kind of things you do on a daily basis that lights your heart up, that it grows your spirit? So find ways to do that. And it's about purpose in life, and I think if you can find your purpose, your spirit will soar. Okay. And then the last dimension is social wellness. Surround yourself with a tribe of people who will challenge you, who will support you, and guide you as you will for them. And you don't need to be around negative people. You have a choice. And if you can find people that you can all grow with. When I moved to Colorado, I was early in my recovery, but we started a study club of like-minded dentists. I didn't know anybody. So I did a scan of all the people I wanted to work with, specialists and general dentists. And we started a study club, and we met on a regular basis to grow our own practices. And they're still my referrers today. We've all grown together 25 years later. That's what I'm talking about. Find ways, go to book club, find ways to connect. We are wired to connect. So if you spend time in each of those 5 dimensions, you're going to have a pretty good life.
Brad, I know you're familiar with the work that they put under the category of the blue zones in the world. There were 5 different geographies around the world where these areas had a much higher percentage of centenarians. And the researchers wanted to find out why. And there was a lot of different factors. But one of those factors was, in all 5 of these places in very different parts of the world, people that lived long lives had a social circle. They had a group of people that were part of their social circle that invigorated them and inspired them, and they enjoyed spending time with. And it was a given. So talk about that social aspect.
Yeah, that's exactly where I got it from.
Yeah,
that's exactly where I come from. The blue zone from Dan something.
I'm gonna look on the bookshelf.
We'll put it in the link.
We'll put it in the link. But blue zones. Certainly, mental health and mental wellness is one of your platforms. Talk about some others.
Second would be benefit reform.
Specifically, can I call it insurance reform?
Yeah, but it's not insurance. It's a benefit. And so I want to take you back to the essential health classification that we established ourselves in. This is going to be controversial to some, but improving benefits both in the public and the private sectors.
Right.
Okay. Where did it become culturally acceptable to put a titanium post here in my hip, but it's not socially acceptable to put a titanium post in my mouth from the insurance benefits? Okay. You can get a titanium hip if you're male, if you're female, if you're young, if you're old. I don't care what color you are or what your socioeconomic status is. You have access to get a hip replacement if you have degenerative hip disease. Okay. If we translated the dental model to medicine, if you had degenerative hip disease, we would give you crutches, because that's what a flipper is. It's a crutch. Why is that? Okay. We have loads and loads of studies and data that prove if we can improve our oral health, we will improve the overall health of our patients. Studies and studies and studies on this. Okay. We've accepted this dental benefit model that we've had, $1,000 max, $1,500 max, 1.5 crowns a year. Okay.
Yeah, go back to the history of that, Brett. I mean,
right.
Go back to 1968.
1970s. Yep.
In 1970, the annual award was $1,000. The average crown fee at that time was $150. It paid 50%. So insurance paid 75, the patient paid 75. How many crowns do they get for their $1,000 annual award?
Yeah.
13 to 14. Well, that's not quite a full mouth reconstruction, but we could coordinate.
It will get you biting. It will get you biting again. Okay. And we've accepted this lousy model. I'm going to say this, could get in trouble for it, because it's worked for us. We've been very successful as a profession. Dentists did well with it, and they're not doing well anymore.
No.
The benefits have not kept up pace with inflation, with the CPI, but we've still been able to make it. And somewhere along the line, it became the cultural norm in the dental professional industry that my practice must have 25% overhead on staff. And we kept it at that, but we couldn't keep it at that with the reimbursement rates we were getting.
Right.
And why do we have a workforce issue right now? As a former private practice owner, we gave benefits, health benefits, vacation benefits, 401k benefits. It's harder and harder for any private practice to do that now, because we're not flush. So I ask you to think a little bit outside of the box. You being the listeners, Gary always thinks out of the box. Why is it okay to get a titanium hip but not a titanium post? Why are we selling ourselves short as not being important enough to recreate the health, the function, and the aesthetics of a good bite? Why are we not being champions of oral health and the masticatory physicians and the masticatory systems, as Peter Dawson taught us? Okay, so we've seen this.
You've given me a chance to think differently about this, and simply substituting the word benefit reform for insurance reform has given me a very different perspective here. And I would hope it does the same. I hope it does the same for our listeners.
Okay, so essential health is, so in December, President Biden asked us to consider helping put together a benefit that would qualify in the essential health realm. And so we put together remember that old plan that we put on the shelf back in 2016. We took it back off the shelf. It still applies today. And so we're giving the government, this is what essential health looks like. Okay, so the politicians, on the other hand, have to find a way to pay for it and what they want to pay for. And so we're going to advocate for the best darn plans that dentists will be happy to be partake in, because they'll be, given a fair fee for their work, and with minimal administrative burden, and low risk of audits, and it will provide the best possible care for our patients without that limiting $1,000 max that people hang on to.
Right.
Okay. What I see in our profession, everyone is scared of this because they're used to, we've been in this rut, and we've decorated that rut and we're comfortable in our rut, but we look outside and we're not so comfortable anymore, but we're more scared of what's over there than what we have in our rut, but we know how to work our rut.
Yeah.
And so and let me also say, baby boomers have a heck of a lot more dentistry in their mouth than the Gen Xers. I'm a Gen Xer.
Right.
Okay. And we spend most of our time as dentists, most of our profits come from maintaining and redoing and moving on to next level dentistry in the baby boomer population. We've got about 20 years of this left where this population will still be there. There's still dentistry to do in my generation, and there will always be dentistry to do in the generations coming up. But my parents' generation, your parents' generation, pretty much every tooth in their mouth had a filling in there when they were a kid. Okay. And that's why we're doing all this work on them now, because it's time to do it. Okay. The business model that we currently have in dentistry pays us based on our drills spinning. And we need to find ways to justify how great dentistry is in the overall health of our patients, and we can get and to get paid for it. Otherwise, dentistry is going to be very, very different 20 years from now. And as the ADA, president-elect of the ADA, soon to be president of the ADA, we have to look forward in the best interest of both the dentists and the patients that we're serving. Okay. And so, and we have the data that shows the improvement, and we can be part of primary care. This is going to send people into tailspins. I know, I don't care. Okay. Because it's going to happen with or without us. We better be at the table to help shape it if it happens.
Well,
when it happens.
As I said before, I couldn't be more thrilled about having you and your passion at the helm in this. As we wrap up, I've got one more topic I want you to address, if you would.
Sure.
Brad, as you know, our listeners range from pre-dental students, believe it or not, pre-dental students. Yeah. And I know for a fact we have at least one 89-year-old practicing dentist listener because he sends me emails. So perhaps we have others that are older. By the way, this dentist is absolutely amazing. He's 89 years old. He practices fee-for-service dentistry. All he does is fashion an image in your mind of an 89-year-old dentist. Brad. All he does is he does places and restores implants using computer-guided technology.
I'm clapping my hands right now.
And he sent me an email and he said, Gary, I guess you'd have to consider me an optimist. I turned 89 earlier this year. And he said, I just renewed my office lease for 10 years. And you know what? If I'm not a gambler, but if I was a gambler, I'm going to bet on him making it. So there's our listeners, pre-dent to very, very senior doctors. For those listeners that are on the sidelines and not active and as a member in organized dentistry, can you give them some reasons why they need to jump in and let them know the water's warm and we need them to be involved?
Well, right back to that first conversation I had with my boss, who told me if we are to remain a profession, everyone has to do their part, at the very least being part of the organized dentistry, whatever that looks like. One voice, unified, is so important, because if we can't, and we are the ADA, we are the world's biggest lever in the profession of dentistry, as I described already today. If we are divided and we don't have this major market share of dentists, we may not always agree on everything. We're not going to, and that's okay, because disagreements, discord brings innovation. It really does. But who's going to be the biggest voice in dentistry if not us? And the more fractured we get, dental insurance companies are just like walking right in, and they're going to tell you, listen, we got to make sure we don't get gouged by those greedy dentists. And we're here to protect your patients, Mr. Senator. Okay. And dentistry can change with one swoop of the pen. Okay. It would have changed in COVID. That's the most recent time that could have changed. It happened when OSHA decided they were going to start declaring dental offices like industrial offices and closing us down because we don't have ladders with yellow and black, those kind of things. Yeah. Okay. And we've got a real chance to shape the future of how the profession will be practiced, to give the younger dentists the same opportunities as your 89-year-old friend, who, by the way, I don't know who he is, but he's my inspiration now. Not you anymore, Gary. It's this guy.
I'll gladly,
because
gladly pass that baton to him.
But dentistry is not going to be the same as it was for me in my lifetime. It's going to be much different for the up and coming dentist, but it's still the best damn profession in all of healthcare, and we got to make sure that stays that way. Only the ADA can do that.
And I'll simply add that you need to have a seat at the table.
Yeah.
Every dentist needs to have a seat at the table.
If we don't, insurance companies will.
Yeah, they will. And I want us to form the future, not them. You know how I feel about insurance.
I do. I do. And you help a lot of my colleagues get off the plans. And it's an amazing niche for you. And you've helped a ton of people. And you've helped the patients get the best possible dentistry as a result, which is amazing. That's why I practice that way.
Thank you. Thank you. Well, Brad, thank you. I know you're extremely busy. You just came off a crazy travel schedule that would have anyone dizzy. And you made time for the podcast today. And I want to simply say thank you. I'll bring it back full circle. Brett's not only a friend, a colleague, an inspiration. And I am so excited about the future and the future of the ADA. And I'm excited to see the innovations and the progress that you make at the helm as the president of the ADA. Thank you for making time for all of us.
Well, I would just say we all play a part in it, and you're a big part of that too. And thank you for all the support and friendship you've given me over the years, and looking forward to many more.
It's mutual. Well, as we wrap up this podcast episode, I want to also say thanks to all of our listeners. We appreciate each and every one of you. And thank you so much for the privilege of your time today. On that note, I look forward to connecting with you on the next Thriving Dentist Show.